Thank you, Councillor. Minister, I don't want to come into this House and suggest that our health service provision is a mess, but clearly some things are not working and some things need to be changed. But I do want to acknowledge the very many people in the service who are doing extraordinary work. I would like to also commend the ongoing development of our community and primary health sectors, and these are fundamental to relieving pressure on our acute hospital systems. In respect of community sector developments, I would congratulate all those in our own area, CHO5 Minister, for the work they do, and I acknowledge your work in the area of mental health services and for older people. And I also want to acknowledge Minister Donnelly's announcement this morning of a new neurology team for CHO5, which is indeed very welcome. I think it's also important, Minister, too, to acknowledge the engagement of government with Section 39 health workers and your own work in terms of the new children's referral for particularly to CAMS and the no wrong door strategy. These are all to be very much welcomed. Just in terms of the drug strategy that Minister Naughton spoke about in her address, could I just point out the very important work that is done in the area of addiction, Minister, and I want to highlight Ashari in Waterford and Jerry Carroll, who do terrific work. But I would tell you, Minister, there's significant problems for funding for organisations like this, and I would ask you please to look in terms of your budget at those who are doing therapy, and particularly addiction therapy counselling. I think the health debate can be clarified into a number of major areas, but they really boil down to a number of things, in my opinion. That's the cost versus efficiency, the service planning and recruitment, the training and retention of staff, the capital delivery, and the future proofing and embedding of technology in our service practices. And what I would say to ministers is what is not measured cannot be managed, and I think we have seen that, and unfortunately a large part of our problems in terms of budgeting is coming because we are not properly monitoring, and we are not looking at the best in class and trying to get others to emulate what they are doing. And that's what will be done in private business. It seems to be something that's anathema, unfortunately, to the public service, that we have stellar exemplars and we let them do what they do, and yet in other units. And ministers, you both know this, particularly in relation to the work that has been done at University Hospital Waterford in terms of the ED management, particularly when the Wexford ED was closed. And how were all those patients managed to be managed, and how were the acute beds managed, and how did we not have patients on trolleys through all that time with the least funded Model 4 in the country and with the least amount of healthcare staff? And no one has tried to look at that as a case and say, why has that happened? I would like to point out to you, Minister, you're probably aware I have written to the senior line minister on this, but one of the issues I raised recently was the number of interns at Beaumont Hospital versus UHW. There was 92 interns in Beaumont, only 25 in University Hospital Waterford, despite University Hospital Waterford does a higher rate of outpatients procedures. So the question was why, and when I wrote to the Minister, what I got back was it's basically the colleges who provide medical education look after placement. This has to be sorted out, Minister. I'd also point to that a budget has not yet been provided to open the second cath lab 7 days per week. You know that, and the commitment is there to do that by Christmas. And I would also point out, from what I understand, money is promised by the HSE to support the activities of UHW during the Wexford emergency department closure. Nothing has been given extra to the budget of UHW. And finally, Minister, just the diabetes unit in Waterford, which has come up. As you know, we have no insulin pump therapy, we have no adult insulin pump programme there. It's the only Model 4 in the country without that. I would ask you to have a look at that.